Hello and welcome back to Doc Talk with Monument Health. With the 4th of July coming up, we're bringing back one of our favorite conversations. I sat down with Dr. Deanna Lassegard, an emergency medicine physician up in Spearfish, to talk fireworks, what she sees in the ER this time of year, and how to keep your holiday off her table. Enjoy. Hello, everybody, and welcome to another edition of Doc Talk with Monument Health. My name is Mark Houston, and joining me today is Dr. Deanna Lassegard, who works as a doctor in the emergency department at Monument Health in Spearfish, correct?
That is correct.
Thanks for joining me today, Doctor.
I'm glad to be here.
This is going to be much less cliched than I thought it was going to be. So I'm very excited to talk about what we're about to talk about. We're going to talk about with the upcoming 4th of July holiday on the way. Fireworks. Okay. You're local though too, right? You went to Central High School here.
I
You're
did,
pretty much
yeah.
born and bred Rapid City.
Yes. Not born here. My
Okay.
dad was in the military, so when he
yes.
got out of the military, he was in the Army. We moved here when I was in 5th grade. So
Okay.
from 5th grade on, I've been here except for when training has taken me away.
Yeah. All right. Where were you before 5th grade then? Where did you
all
live here?
over the place. We lived
Just
in
everywhere.
Germany. We
Military
lived in
kid.
Colorado Springs. Yeah. all
Did you
over the
like
place.
Germany when you
We
were there?
loved
Did you
it. It was
did you
amazing.
remember a lot of it?
1st grade through 4th grade, so kind of all of those like childhood formative years
Yeah.
were spent in Germany. So
Those
that
are
was
some of the best. Can you still speak German? Do you have any?
very poorly, as it turns out. I thought I did better, and then my husband and I went back a few years ago, and as it turns out, I have not retained that skill.
That's a hard one to retain from that age, though, if you don't practice it.
It is, and the things that I knew back then are not the things that I need to know now.
Right.
You know.
Yeah,
so.
especially when you're vacation traveling, for
Yeah.
sure. So you started out as a paramedic, correct?
Yes.
What pushed you in that direction?
Well, at that time, they had an EMT class at Western Dakota Tech that you could take through high school. And so you could get dual enrollment credit. You could do high school credit and you could get college credit for it. And my dad thought it would be a fantastic idea. My dad is a physician, and he thought that that would be a great class to learn some real life skills before you go off into college and know how to do the Heimlich maneuver, know how to stop bleeding, know when to call 911, those kinds of things. And so I took the class fully anticipating it would just be a class that I would enjoy, and it ended up being my entire career path.
That's, because a lot of us should know those things. Those are all basic things everybody should know.
Oh, absolutely.
But then there must be a part of you that's a little bit of a thrill seeker, sort of, because
it's odd because not for myself.
Really?
No, like I'm not the girl who, would ever consider like jumping out of planes or, even things that I would consider moderately dangerous, like mountain biking. Like I don't do that kind of stuff. I'm kind of risk adverse when it comes to my own safety.
I guess what's interesting is you don't mind cleaning up after a lot of that stuff.
No, I don't.
When the accidents happen. Oh, that's the job of paramedic to me has to be one of the most just stressful jobs, though. Did you feel that way as a paramedic?
It is a stressful job, but the thing about being a paramedic that I thought was really good is you have a team with you all the time. So
Okay.
there's always someone that you're on call with. And if you're working for a busier service, you're at a base where there's other people that are responding to calls too on other ambulance crews. And so it was very much a family.
Mm-hmm.
And I think like the fire service and the police service can they're on the same plane about that. The people that you work with just become your family. And so although you saw a lot of bad things and it could be very stressful, you had a team that you were very dependent upon and worked with very closely. And so that was nice, is that you had that real team kind of effort.
So having your father as a physician, then did you once you kind of got into the paramedic role, did you see that the trajectory was there then maybe to become a doctor?
Not immediately,
Okay.
because it is very expensive and it's a very long road to becoming a doctor. And in my late teens, early 20s, I just could not see sacrificing all of like my best years going and spending time in school. And so I did the paramedic, and then I decided, well, I'll just bite off another chunk, and I got a bachelor's degree in nursing, and so I worked as a nurse for a while. And then that wasn't enough. I wanted to know more. I knew that there was so much more out there. There was like this cool club of people who like understood things I didn't understand, and I wanted to know those things. And so,
Well, and I think you did it the right way, just biting off the little chunks,
biting off more student loan debt.
Right.
Each little chunk.
Yeah, exactly.
Just another.
That's right. So now you're a full-blown doctor. You work in the emergency department like we said, in Spearfish.
Mm-hmm.
I thought when the 4th of July rolled around and everybody talks about the accidents and the issues, it couldn't be like everybody says. And so I've never talked to an emergency room doctor, and you're telling me, oh, it absolutely is, like everybody says.
The volume of patients that we see in the emergency department is definitely up surrounding this holiday, without a doubt. Are we dragging people out in body bags? No, like
of course
this,
not.
This is not that kind of situation. But we definitely see way more burns, especially leading up to the 4th of July and the 4th of July. And we see a lot, like all of our fireworks injuries essentially happen within that week period of time. Every once in a while, somebody gets a hold of a firework on in February.
Well, we can do them on New Year's now too. So do you see some then maybe come in as well?
We don't see near as many on New Year's as we see on the 4th
it's too
of
cold
July.
to be outside to do any of that stuff around New Year's.
That's probably true.
Most of them don't want to. Do you have? Is there any? Do you have like a particularly memorable case where you think your expertise kind of played a role in treating a firework-related injury?
Well,
on the top of your mind?
A lot of these actually don't involve definitive care in the emergency department. So my role, with the really bad ones, my role as an ER physician is to get them to who they need to be.
Okay.
Who they need to be with.
Right.
And so for serious firework injuries, that's eye and face and hand mostly. And so we do a lot of the temporizing measures, getting things started, getting pain controlled, and then getting them to the ophthalmologist or getting them to the hand surgeon. And so definitive care on the severe fireworks injuries does not happen in the emergency department. We're kind of the gateway to getting them into the system. For the more minor things, the things that aren't going to require surgery, we do definitive care for that.
So
we treat the burns, and
there's surgery that's sometimes required with fireworks too?
Yeah.
Good
Unfortunately, frequently when people have explosive fireworks, that explodes through tissue and bones. And so there will be fractures and there will be tissue missing. And some of those can be very complex and long-term disabling to get back together.
I guess I'm trying to just think of what firework I have ever purchased in my life that could do so.
You'd be surprised.
That would be my next question.
Even the little fireworks, even, like the little bottle rockets and things like that. If you're not handling them safely, if you have them in an enclosed hand, where that pressure can't be released, that can cause significant damage to your hand, just a bottle rocket. And there's always that misconception that bottle rockets, sparklers, things like that are safe fireworks.
Right.
Like those aren't the dangerous ones, but that's not the case. And so we see those types of injuries with that. But then when you start getting into the mortars, that's where things get a little extra hairy. That's where people are losing body parts and long-term disability type issues come in.
So what about another thing, just kind of researching a little and thinking about this, you mentioned the hands, the face, the eyes. That's always the most dangerous part. But I have to imagine that there can be some pretty severe damage that happens to hearing too in cases like this, isn't there?
You can get perforated eardrums. That's only from the bigger stuff.
Right.
And generally that can be fixed.
Okay.
That's a pretty minor slice of the pie of the things that happen with fireworks. Burns and fractures kind of being the biggest. Eye injuries kind of being the next slice. Leg injuries, sometimes people step on things that are still hot or something shoots them in the leg. And then a ways down that list is where you get to ear problems.
Okay. What about things like PTSD for people that can kind of suffer in that area too?
I've heard a lot about that. I've heard a lot about people who've been in, traumatic situations where there's been gunfire overseas or in combat situations and how that's really brings those kind of things up. But I can't say that we've seen a lot of that in the emergency department.
So there has to be things that you see when you come in that you treat, you ship them off to the right place, and then after you're done, you just put your head in your hands and you're like, why did they do this thing? I mean, what would be the number one thing you want to tell people?
Do not mix alcohol and fireworks. if we could sum this up into a 2-second little blurb, alcohol and fireworks do not mix.
That's the one.
Yeah.
I suppose.
If you had a third component, it would be the male gender.
Oh.
Yes.
Look,
68% of serious fireworks injuries are in males.
We're just trying to impress you guys, okay? That's what this comes down to. We're not good at it.
Yeah.
Advice for like parents with kids too. What would you want to?
It's tough because you don't want to be like that parent who doesn't allow anything and there's no fun. But I feel like there's a big misconception with safe fireworks when it comes to like everybody's like, oh yeah, I understand, like we shouldn't be firing off big mortars and things like that. That could be dangerous. But then they supplement that with bottle rockets and with sparklers. And sparklers are actually one of the most common reasons we see people in the ER. They burn so hot, 1,800 degrees Fahrenheit, melting metal type hot. And so just a drip, a second, a touch, huge, deep burns.
Right.
And so I feel like parents often are trying to make the right choices and choosing like what's the safest way to celebrate this holiday without just being a total Debbie Downer. And then they supplement that with sparklers. And sparklers, unfortunately, can also be very dangerous. Nothing's going to explode necessarily with a sparkler, but the burns can be quite severe from that. And if you're talking about burns to the hands or to the face, those can be scarring, and those can leave like lifelong disability problems if you've got scarring over joints of your hand or it ends up on your eye.
Oh, jeez.
You kind of need two of them.
Yeah. I did have, well, you were speaking of the sparklers. I remember being a young kid. I had an older brother. That could be where a lot of this trauma for me started from, using sparklers and then him telling me that, no, the bright part's not hot. You can grab that. And I did. And I remember a blister on the palm of my hand and just for weeks afterwards. It was unbearably painful.
Kind of ruins the holiday, doesn't it?
It totally ruined the holiday. And then I always ask my mom, where were you when this was happening? She's like, I was busy. We were in the kitchen or something. I don't know.
Yeah, children of the 80s were raised a lot differently than children of the 2020s.
A lot of Gen Xers were, we're surprised we're still here. Well, of course, it is in a way cliche to say that you need to be safe around fireworks.
Absolutely.
But it's comforting to know that there are doctors like you that will be working over that holiday to make sure everybody's taken care of. And the advice you've given here is again pretty common sense stuff. But I would love to talk with you again sometime about the rest of this stuff that
just
you deal with.
Just come ruin some other holiday and some other wholesome activity for you. We could talk about trampolines and bicycles without helmets.
Yes, I would love to talk about all of that kind of safety stuff.
Any kind of fun activity you have, I can come right on that parade for you.
But honestly, you are not ruining it because I don't think that people, I don't think they take it seriously enough. And then when they hear from somebody like you that sees the absolute worst parts of when these accidents happen, that might click with them a little bit better, so.
Yeah, my overall recommendation is when it comes to fireworks is it's best left to the pros. Go watch the professional displays. We are so lucky in the Black Hills area that we have so many of them that you can get to and go to. And they're fun and they're wholesome and they're safe. And so I think that's probably the best alternative. The next best alternative is like silly string and glow sticks and the little sparkle wands and things like that.
Well, now you can get silly string right in your eye, doctor.
You could, but it is much less damaging than a bottle rocket in the eye.
Have you ever been injured by fireworks? Were you ever injured?
I have not ever been injured by fireworks.
Good
but
job.
Like we said, I'm kind of risk adverse.
Okay. Well, but your husband though.
Oh, my husband. He's done a lot of dumb things. Yeah, he was of the era of sparkler bombs, which is complete. Like, don't do that.
All right.
Messing with the fireworks, reassembling the fireworks, making your own fireworks, that is really a recipe for disaster.
Well, he and I could hang out then. That'd be fun. Right, he sounds like a fun guy, actually.
Make sure one of you has fingers enough to dial 911.
Okay, great. Dr. Deanna Lassegard, an emergency room doctor from Monument Health and Spearfish, thank you very much for talking with us.
My pleasure.